little BMI, tool on the website as well. You can also ask our handy little top.
That's
bot.
right, the top bot. You can ask definitely what's that. But normal BMI is the gold. So normal BMI is between 18 and 24. Maybe not 18, but why not 24? 24 would be great, or as close to it as you can. So let's see, Gloria's here.
Yeah, it just makes things easier, and it's better and safer for you as well going under anesthesia. So
these things always starts showing me some requests, and then they go away. Let's see if Gloria wants to come.
And of course, as always, if you want to take advantage of the quick free consult, both of us here, then
hello.
If you want to put her
Hey Gloria, let's up the volume. Can you hear us?
I'm fine. How are you?
Pretty good.
Can we screen
yeah,
share?
let me see if I can put you back on the big screen over there. How are you? How are you doing? Here it is. Let's see. Samsung. Here it is. All right.
We're trying to get someone live for you guys up there.
There. Hi Gloria.
Hello.
How are you?
I'm fine. How are you doing?
Pretty good. It's a cute little little cat that you had in there.
We can keep the cat.
Maybe he has a question, or she. Oh, that's so cute.
Aww. Very cute.
What's the cat's name?
Anta.
Nice.
That means strong boy.
Nice.
Very nice.
That is a boy.
Yeah. Doctor, I have a couple of questions.
Tell me.
Okay? Wait, let me show you a little bit. So,
We can see. Looks nice.
but I have a problem. Do you know the side where we have the drain
Yes.
coming out? There is one side a little bit like, it's not like the same as the same curves, like
Okay.
one or bumpy. Can we do anything about it?
Yes, of course. Yeah, a lot of times we do. Well, there's a few things depending. Send us pictures and we'll let you know. But depending on the severity of that, sometimes with a little bit of lipo we can just do it, or sometimes we just have to remove a little bit of skin on the edge of the incision, and then that will take it. That will probably fix it. It's not uncommon. It's not uncommon to have that.
Me and Nanny, we have the same problem this area.
Yeah, that is a common problem. A lot of times when you cinch the waistline, sometimes there's some fullness at the edge of the incision that is not as obvious at the time of surgery. Once the swelling goes away, then it starts to show more and more, but it's easy to fix.
From the drainage.
Yes.
That's why I think if it's gonna go by time, it's not gonna stay. So, in all cases, we're coming to visit you.
Perfect.
Because I need to order it.
You look amazing. That's a good point that you make. And this is the usual way that we fix that, is for all the patients that are, let's say, on a BMI of over 25, maybe overweight or even over 30, and we do the procedures, a lot of times we recommend to do some lipo after a year or so after the surgery. And at that time, we definitely can address that issue and obviously get you in much better shape.
But it didn't pass 1 year.
No, I know. That's what I'm saying. It's still early.
But I would love to come back.
Perfect.
Soon.
Make sure, send us a follow-up with some pictures. With the link that we'll send you, send us a follow-up. But you look amazing.
Doctor, one more thing. You know that the belly button, that you move it down?
Yeah, at that time, we can definitely do that too.
It has like this one.
Yes, I know. Remember that sometimes the vertical incision is left at the bottom where your belly button used to be before. When we do the revisions at about a year, we can always remove it all or almost all.
No, what to remove it all? We're gonna open again?
Well, it's very tiny amount if we have to, but nothing like before. Like you don't need any downtime to heal from that.
Okay. And a question, because Manish cannot come, so she told me to ask you.
Okay.
So happy with the result. Everything was amazing. But women always like want to have something new always, and everything is perfect. So Maggie is asking. She has one side, she did the BBL.
Right.
One side is super perfect. The second side, where the damage is, the fat is not still up. It's not going down. So she told me, please ask Dr. Palladino.
That's awesome.
How it,
So the best way to address that is that she sent me a picture so I can actually see what she's talking about. I think I understand what she's talking about. First of all, it's early, so I think it hasn't been even 6 months yet. So give her some time. Once you get to the 6 months, we'll see. Send us the follow up, and we will definitely address it. But I don't think that is very very difficult to fix.
it is fixed, yes, or it because the fat is on the top.
Right,
So it could,
right.
It's not.
It could be that. It could be that her.
But beautiful.
Nice.
And to remember her belly, she had like problem with the belly, and her stomach is always like. After she did it,
She did great.
it's amazing.
Awesome.
Like, I'm so happy with the result.
Good, good. Well, we are so happy that you guys are happy. Really, I mean, I remember both of you, and it's good to have a like a partner for surgery. So it was nice.
Didn't have friends and companions.
That's awesome. No, that's perfect. Send me your follow-ups at 6 months.
One more time, my arms.
We can.
They,
Yeah,
they set, and between my legs. I know we couldn't take too much.
That's right. Yeah, because we were already doing quite a few procedures. So, but yes, definitely we can address that the following time. Yeah.
I was trusting you because I know we cannot take too much fat one time. So we're gonna do the live for next time. I can't wait to see you.
Thank you, Gloria. Thank you very much. Thank you for logging in. You look amazing. I'm glad.
Absolutely.
Yeah, thank you. We'll keep in touch, okay? Send me some pictures.
We'll see you soon.
Gracias.
All right, let's see. Dollface says she's having surgery with me next Thursday. I'm so excited. Can't wait
That
to
is
meet you
awesome.
on the staff. We're just as excited to see you as well.
Your-
Case.
Your patient today looked amazing.
Yeah, we had a full-on mommy makeover.
It was, and she already had, let's call it substandard procedure. There's a show called Botched. We don't like that word, but she had a little bit of an uneven incision, too high, and now she had a mommy makeover, and she looks really good, amazing, really.
Yeah,
It is.
we'll hopefully be able to showcase that soon.
Mhm.
But a huge mommy makeover all around. Looks great. Casey Littlefoot, hi. Can't wait to hear about your experience.
Let's see how Ariane is doing here. She wants to log in here.
Will you do over the muscle Johnston twin mama? I'm not sure what you're asking. Or maybe implants? All right.
Hello.
Hi.
Hi guys.
How are you?
I remember you.
I remember you. How's it going?
Pretty good. I'm glad to see you here. Seems like you're doing better.
I'm doing so much better
That is
since
great.
I left.
That is
the other
awesome.
day.
That is awesome. Yeah, I think you were a little dehydrated, mainly. So you were not drinking enough, or you were not feeling that great. So that all is like a,
Yeah, I wasn't
Good.
eating either. I hadn't eaten at that point. I think I was on day 8 of not eating anything, let alone protein. So I was.
But you look awesome. You look amazing.
Thank
Seriously.
you. I have one question, just one. Because like post-op is telling me one thing, and then this lymphatic drainage massage lady is
Sure.
telling me something so cool. And so I am in my faja. I hate the faja. I hate wearing a faja. I hate having to see through a hole. I hate it.
In a month, you're not gonna want to take it out. You watch.
I love the compression of it. Well, then I asked post-op, and they said I could wear
The waist trainer. Yeah, of course that.
So I got myself in it. It says medium. I got myself in it, but it is like, it's restricting. So the lymphatic lady was like, absolutely not. You cannot be in this. This is doing more harm than good. But my faja is size like XL from the very beginning.
Right.
So I have the 4 foams in, and I'm still like.
Right. Don't pay right. That's right. So don't pay a lot of attention to the sizes, because the sizes vary so much. The faja is stretched and all of that. So sometimes that's the main issue, and sometimes the size of the faja doesn't 100% correlate with the size of the waist trainer. But what matters is how tight it is. So if it's extremely tight, you're not quite ready for the waist trainer just yet. At least not with everything on top. Like with the foams and So you wait. Wait until you get a little bit more reduction, and then you can do it. Or remove everything and try to use a waist trainer, maybe on on top of a t-shirt or something, and see if that's enough. You want compression, but you don't want to be extremely restricted to the point that it's hard to breathe. So definitely not.
So like I wore it since the day I left you on until I saw her yesterday, and I thought it's tight. I can't get it on myself, but it feels like compression, and it feels like a waist trainer. Like it's not. I can breathe. Like I'm okay. But she was like, all your fluids, you're getting swollen, you're pushing fluids, but this is doing nothing.
Right. No, you want compression. You want compression. Were you using it with the foams in place?
No, I was using it with.
Okay. Oh, we lost her. But yeah, so usually without the foams will be better. Obviously, if it's too tight, and yeah, we want
compression is key. Because you want that skin to kind of stick to your fascia and be really tight. Because if it's too loose, it might not happen and it'll be loose. You don't want it too tight, because if it's too tight, it can actually form indentations. So you want a good fitting compression.
And at the same time, the swelling sets in if you don't have compression. So you want to minimize the amount of swelling that you have, that you get. There you go. We got you back. That's all right. You're back. So we were saying, it's important to have the compression to avoid swelling and to get your skin to stick down. So it is important to have the compression. But if it's too loose, it's not doing anything. So I'd rather have you with a little bit compression and not too loose. You might have to find something in between. Maybe a faja that is one size or 2 sizes lower than yours now, and go with that one before you transition into the waist trainer.
I bought an extender for it, basically a bra.
Perfect.
The same thing, so that I didn't have to get a whole nother one just for, because I can tell the swelling's going down. The cut, since I saw you, opened up too, so now that's starting to open. But Vanessa said that it's probably just because no protein.
Yeah.
So things are opening.
Yeah, the incisions sometimes misbehave. They usually heal perfectly fine later, and if nothing, we have to do a little scar revision if necessary. It's very unlikely though. So you'll see if it opens up. A lot of times the stitches start spitting out sometimes, and that heals without any issues.
And now that we're doing wet to dry for this one,
right?
How long do you think until this is closed, and how big of a scar do you think?
Nothing. Yeah, no, that's gonna be a quarter of the size of what you see now, and it's just doing. Your case, probably nothing needs to be done, so it's so little. So, but you look so good. You look, we saw you, last week. You are looking amazing.
Thank you, and everything was awesome. No one knows how your body's gonna react. Obviously.
Right. No, you feel.
Very well, but you guys were awesome. Start to finish, everything's perfect.
Amazing. Thank you so much for tuning in. Keep the proteins up and your hydration, and let us know if you need anything.
Thank you.
Bye.
Very good to see you. Bye.
Bye.
Yeah, so compression key. There was I think the same question follow-up was yes, they were referring to implants. Implants, 99% of the time, me and Dr. Palladino both, we put under the muscle. It's just in terms of longevity. Remember, your muscles are holding on to that implant, so there's less chance of bottoming out or dropping too much. There's less chance of capsular contracture. There's less chance of rippling because your muscle's over it. Yes, it's a technically more challenging, surgery, but that's for us to figure out, So the only issue that really for the patients is it's a little bit more painful in the immediate day or two post-op because we are cutting some muscle. But after that, it's perfectly fine. Very rarely do we put implants over the muscle. It really depends on the anatomy of the breast of that certain individual. If we want the skin to get loose or stretch a little bit, perhaps, or sometimes in very, very, very heavy bodybuilders and so forth. But 99% of the time, these implants go into the muscle in a lift and an augmentation as well. Maybe there's a Spanish question you want to answer?
Hola doctor, tengo mi cirugía en octubre, pero me han encontrado unos fibromas. Si necesitaría cirugía, ¿cuánto recomendaría esperar? Habría que ver con respecto a los fibromas qué tan grandes son y si hay que quitarlos. Si tienes que tener cirugía por los fibromas, nosotros recomendamos esperar 6 meses. Lo mismo que si tienes una cesárea, lo mismo si tienes algún tipo de cirugía antes, lo mejor es esperar unos 6 meses para tener tu cirugía. Pero hay que ver, si los fibromas son grandes y te están dando problemas, mejor tratar los fibromas antes de la cirugía. So for the patients that have fibroids, usually in the uterus, and they tend to bleed or be symptomatic, it's better to get them addressed before any surgeries with us, so because that will make you bleed more, have the tendency to become more anemic. So if you can just treat the fibroids before, that's preferred. Right. Dr. Paladino, I had my surgery this Thursday. The whole experience was amazing from beginning to end. I'm back. I'm feeling great 5 days post-op. That is awesome. Well, glad to hear. For those of you that feel ready to show some of your results, we would love to connect with you. Thank you very much for sharing that. And it's always good to share your experience also. See what did you enjoy the most about the experience with us. So I think that helps everybody understand what we are doing here, which is a little bit different than most. How long do you require to wear compression? How long?
I mean,
would you say?
The longer the better. I usually say a lot of patients actually want to keep wearing the compression because they feel more snug. Minimum 6 weeks is the absolute minimum. I would say at least 8 to 12 weeks. And then there's stage 1, stage 2. If you can even wear into these long Spanx even later, the ones that you can get from some of these athletic shops, and wear a little bit later on, a couple weeks after your surgery, that can work too. But the more you can wear it, the less chance of a seroma, swelling, better your contour is going to be.
That's right. Yeah, I agree. I mean, and patients usually after a month or two, they really want to keep wearing the compression. They don't want to take it out. It's interesting. They feel more secure, safer, so it's not that bad. At the beginning it's uncomfortable, but then once the swelling goes away, it becomes, part of what you want to wear.
And if you're getting back into the exercise routine after 6 to 8 weeks, you'd want to wear like a Spanx sort of, compression. It'll minimize the swelling. Jenny
Dreambody is asking, how much do you charge for implant exchange? And how do you determine if you need a tummy tuck of Lipo360? Okay, so for implant exchange it varies because we need to see if we have to do just the implant exchange, we have to do a capsule, we have to do a lift. So the best thing to do is you go to our website. There's a little button in the corner that says book now. Actually, if you go there, you just book a consultation, so you can go there. Let's see if I can find my arrow here. Oh, there it is. It's the seating. So you go there, book now, and then it takes you to this get a free consultation form. Just click here, fill out this quick form, and there you go. And that we'll send you a quote with pictures, please. So in your case, probably without bra, you can include like from your chin to your belly button, and so we can see the type, the breast and where it is. And in the comments, give us some information about your, where you had your previous procedure and so forth. In regards to the difference between tummy tuck and lipo, also important to send us pictures. We can tell if you've been pregnant before. We can see the amount of bulging that you may have or skin excess. So in those cases, you're probably going to be a better candidate for a tummy tuck. But usually from the pictures we can tell if you're a good candidate for one or the other. You know what?
Yeah, absolutely. Of course, pictures, that's the best way, or a live in-person consult. But for the most part, remember, with the tummy tuck, we're not only able to address, the fat, we're also able to address the loose skin, and we're also able to address the muscle repair, right?
That's right.
If you were pregnant and you have the diastasis, you can't do those last two with a Lipo 360. So if you're a young patient with really good, nice skin, never been, affected by pregnancies and so forth, then most of the time lipo would work. But if you're the latter, then we like to, in general, be a little bit more aggressive if you fall in the tummy tuck category, just because we know the results you're going to get with a tummy tuck and the muscle repair and the skin excision compared to a Lipo 360. But if you can get away with a Lipo 360 and Renuvion, of course, looking at your pictures will let you know.
Yeah, so Kartikta, she says, do you do lipo with Renuvion, which is J plasma, and how do you know that what's the best for your thighs and arms? So we definitely use Renuvion, which is the J plasma, and we definitely think it works really well for areas such as the arms and the thighs, as well as the neck, as well as the brow line. Those areas that is really difficult to remove skin and you want the maximum shrinkage of your skin. I think Renuvion is great. Your experience about the same, I think.
So we're not excising or cutting skin with Renuvion. Basically, after liposuction, this device goes underneath your skin and it heats something called your fibroseptal network, which are these little bands that go from your skin down, and what that heat does is it causes it to contract. And not only does it do that, but over the course of several months to a year, because of that heat, it induces collagen formation. So all of these things together help tighten the skin to a certain extent, not as well as skin excision, but it helps if you're doing a lot of liposuction and removing fat. If your skin's not in the best shape, or you've lost a lot of weight, or you might end up with some loose skin, this will definitely be helpful, a helpful procedure to add on.
Also, Jenny's asking if we do ultrasound guidance lipo. So we definitely are one of the pioneers in ultrasound guidance, but it comes to like fat injections. During the lipo, it's not that critical, the ultrasound guidance, although, for example, today we treated a patient that had a little lipoma on the back, and we treated with lipo. So with the ultrasound, we can see how much residual fat is left. So it's helpful for those cases. But lipo is a very more manual type of procedure, so you can actually feel and pinch the skin to see the level of lipo that you want. So liposuction, ultrasound guided liposuction is not critical, but the fat transfer is critical. And it's definitely mandatory here in Florida, and we've been using it, and we've trained people on how to do that. So we definitely use ultrasound guidance, and in fat transfer to the buttocks on BBLs. So that's important to know. When you're looking around, everybody should know about what's the.
Yeah, and a good place to, if you want to learn about it, is the World Association of Gluteal Surgeons website, where you can go, and they have a ton of information regarding ultrasound guided fat transfer, the rules and regulations in Florida, and even training for other surgeons who want to train. There's a few places around the country, us being one of them, to train in these ultrasound guided fat transfer procedures.
So Jenny's saying, thank you. Yes, I had a lift and an implant about a month ago, and I'm not satisfied with the implant size I choose. I really wish I had gone bigger. Yeah, those. I believe it's not necessarily your fault itself. It's hard for the patient to say, no, I want so many cc's. I think it has to do a lot with the experience of the surgeon, how they guide you. In our opinion, it's best that you bring us a wish pick, and once you show us a wish pick, we know more or less what to do for your body, to look like that wish pick. So that is more beneficial. So I agree, most patients do regret not going a little bit larger, or more, or quite a bit larger. We try to err on that side. So our patients are, in general, extremely happy. And I would, had to really think hard on somebody that says, "Oh, I'm too large." Well, on the contrary, if you try to be conservative, the patients will complain about not going large enough. So, and then the other thing is if you need a lift, then sometimes it's easier to match with the lift. Because if you need a lift and they don't do the lift, then you need a larger implant. In your case, it seems that you did the lift, but the size is not correct. So you had to wait. Now I would say wait about probably a good 6 months minimum, maybe closer to a year, and then you can always go a little bit larger, put larger implants. Not a big deal.
Yeah, exchanging implants is a very quick procedure, but also sometimes your chest might not accommodate a certain size in the beginning. We measure your breast width to make sure that the implant or the size that you want can actually fit. If your chest accommodates a certain size and we go too much bigger, you can end up with an implant, in your, armpit or too medially. So we can always go bigger or later, but we also measure your breast dimensions and be like, okay, here's the range that your body would be able to tolerate to go with. So it's not always, the patient's fault either. It may be their anatomy. But yes, we do err on the larger size because that's what we've noticed. Patients, if they complain, they always wish they went bigger.
Yeah, so here we have a question. Somebody that had to cancel surgery before and now they're ready for it. Yeah, no problem. I think the best thing to do is to recontact your coordinator, and then we'll guide you through the process. If it's been too long, we might have you submit a new request, but we can look at what happened before and guide you through. No problem. Yes, quote please. Well, we are happy to send you the quotes. Absolutely. Here, look, book now, get a free consultation. Our website, pretty beautiful website. Go here, click book now, send us a free consultation.
I think she's asking if she can get her original quote.
Yeah, but talk to your coordinator. Yeah, we can see. I'm not sure. That is a very personal question. We need to see exactly what what happened, what changed. Was it 5 years ago?
Says it was 1 month ago.
Okay, 1 month ago, probably yes.
We'll reach out to the coordinator. I think she mentioned she's not honoring the quote. We can speak to the coordinator and see what's going on and perhaps look into it.
Yeah, these are very personal, particular case to you. It's probably like these lives are more for like general questions, but we're happy to connect with you outside the live and go over your particular situation.
Someone was asking about specials.
Was asking about specials. Was asking about specials.
So once again, once you set those quotes to the coordinators, they'll let you know. We did have a couple that just passed.
You still might be able to be a candidate for the $99 special or the $250 booking special for the booking fees, but you had to submit your quote and then or your consultation, and then we will get you a quote. If you can do these procedures before certain times, like for say September or for before December, then we have special pricing for booking too.
Yeah, we'd honor if in this time frame there are some openings in the schedule that if we can fit you in, we could possibly honor those specials. Someone asked, do I have to have my belly button moved if I just want some skin tightening on my stomach? No. If you just do liposuction or liposuction with J-plasma skin tightening, we don't move any belly button. In fact, even in a mini tummy tuck,
that's right,
we don't move your belly button. So if you send us pictures and a consult, we can guide you in the right way and let you know if that's something that can be done. Of course, if you just wanted liposuction as well and didn't want a tummy tuck and you have a good amount of skin laxity, we'd also inform you that what could be the downside to that. But send us pictures, we'll take a look.
Jenny, she continues to ask about how much would it be for the implant exchange. Okay, that's fine. Usually it will be probably just like a breast augmentation. You know, it will be something in the like 5,000 to 6,000 perhaps. You know, depending, but it all depends on how you look back in 7 months. You know, and if we agree that it's just an implant exchange will be that. But for you to have a clear idea, it can be like, let's say, from about 5,000 to perhaps, you know, 8,500 if we had to do a lift or things like that. You know, so that's kind of the ballpark pricing, but, you know, not 100% sure.
Yeah, and it also depends if you have, you know, for example, a capsular contracture, or there's issues where we have to do additional work and rework the pocket, make it so.
Yeah, she's the one that had a breast lift and augmentation a month ago, and she wants to know, you know, in a few. Yeah, maybe go a little bit bigger. So yeah, I always think though going a little bit bigger is a little bit easier. If you go smaller, you have to actually like reclose.
Yeah, you have to do more work with the actual pocket if you go smaller.
Right.
So
right. Okay, so that's. All right, Mercedes had a stress test today, hoping surgery have October 12th. Okay, great. Hopefully everything goes well. Can you do skinny BBL on someone who's 5'5" and weighs 135? Yeah, absolutely. That sounds like a really, really good.
listen, skinny BBLs actually, you know, as long as there are, we can get something. Actually, the patients, you know, usually end up with a really, really nice result. So
Yeah. And your measurements sound about right. So 100% sure that you can have a skinny BBL. Don't waste your fat. Use it, you know. So if you're having a question, I always think that having a small BBL, even if it's a small amount, I think it always looks great. It's actually a really good opinion. So we wanted to tell you, especially for all of you that are past patients of ours, just to make sure you follow up with us. Use our virtual follow-up, you know, links that we send you. Be consistent with it so we can actually follow through, give you the new before and afters. And I know for those of you that are going to have surgery, also consider getting the SozoFit, the suit. You know, the SozoFit suit to take your measurements before surgery, and then continue to take your measurements as you move away or along the follow-up. And if you send us, we can actually see how much your body is changing and measure it accurately. I mean, it's a really cool technology. And if you're around next week, we're gonna have the people from SozoFit participating in our live, so you can learn more about it. And this is the actual people that, you know, is behind the technology and the product. And then we will have a few available for you to.
Yeah, tune in if you want to get a little bit more info from that. People that actually work for SozoFit. Next week, right?
Yeah, next week,
to get
next
a little
Tuesday.
bit more info. So check that out. Lori, speak with the coordinator if they can fit you in one of those time dates that the specials were. Perhaps they can give you a special rate. Just speak to them. You know, I'll let them know as well. So, but reach out to them.
Yeah, I think that's the similar special that we were running. I don't remember. Is it, what did you say, $15.99.99 for the 2 procedures? That's the one that we just finished. If you were locked for that one, it's possibly that we can, you know, put you in, especially if you want to do it sometime in, you know, soon, like in October. Dice Noé, dice, hola doctor Paladino, hace 2 meses me hizo mi cirugía y me siento y me veo muy bien, gracias a Dios y a usted, muchas gracias, y a todo su personal, todos fueron muy amables. Qué bueno escuchar tus palabras, qué bueno que estás contenta, y si quieres aquí mostrarnos tus resultados, cuando puedas nos llamas, nos invitas y te traemos aquí con nosotros para hablar y que nos muestres tus resultados. Gracias por enviarnos. A ver si no quiere venir.
One up there too. Let's see what else we got
Sí,
here.
some more. So we're going blind, you know.
I know. Yep. So we talked about skinny BBL. Lizzie asked, what kind of implants do we use?
We use usually silicone implants. We use Natural implants from Allergan and Sientra implants too. So, depending on what's best for you, we're gonna choose the one that fits you better. We prefer silicone on top of saline. Although if you want saline, we can definitely do it, and we have them. Here at Top Aesthetics, we have what we call a consignment. So we have pretty much all sizes. So we can pick whatever we want and fits better for you, and we have a bunch here, so we can just use it and we don't have to wait or ship them.
Yeah, and also in multiple profiles as well, not just moderate or full. We have the full gamut here. So if you're looking for a certain look and you bring your wish pics, we can definitely get that going as well.
That's awesome. So M80J, she's saying, hi doctor, I got my tummy tuck in June. Can I go to the beach in September? I'm so happy with my results. Great. So yes, I think by September, if everything's nice and healed, you should be able to enjoy your results in the beach. That's actually the reason why you did it. So
We'll
that's
get you beach
awesome.
ready in September.
That's right. And we always said, if you wanted to be ready by December, then have your surgery in September. So if you didn't hear it,
Favorite set, right? Yeah. What else?
Hola doctor, siempre lo sigo. Pero es mi sueño llegar a operarme con usted. Qué bueno. Pues aquí estamos, Rosa, cuando quieras nos mandas tu información y nosotros estaremos listos. Será un placer. Son los mejores. Qué bueno, qué bueno. Ok, vamos a hablar un poquito de cómo es nuestro proceso aquí en Top Aesthetics. Guys, at Top Aesthetics we have the whole thing figured out for you, and I think this is something that you have to really consider when you're just looking for plastic surgery options. Here we have everything in one setting, so we take care of obviously the pre-op, right? So we guide you through the process. Then the operative setting is super nice and super safe. And then not only that, but the best part is the post-operative options. And with the post-operative options, we actually care for you. We invest a lot for you to recover quickly because we are taking care of you. We don't send you anywhere. We don't have you just look for a place to recover. We don't have you just look for somebody to do massages. We do all that for you. We did the work. We chose the best people, and this is the people that's going to be caring for you and helping your companion through the process, the early post-op process, which is not really easy. So that's one of the main things that you have to consider when you're looking for plastic surgery options, and we have it all included for you. So it's one of the main things that we continue to emphasize, because people really usually, although they might have a good result, the experience is on one hand dangerous, on another hand is miserable, to go through these early post-op, and it could be dangerous. People oftentimes end up in the hospital with a really high hospital bill for no reason, so it is important to consider all these things when you're looking into different options.
Yeah, I mean, we just want you to, go back to the hotel and heal. That's what we've sort of based everything on, and it makes your life easier, your companion's life easier, it makes our life easier because we get to know that someone's with you, monitoring you, we're checking your vitals, we have them sent to our iPads and our phones if anything goes awry, and we have a whole team that goes there and does a virtual with you at any time, if needed, and on certain days as well. So it's a great experience for everyone involved.
Okay, so we have here, I'm coming to you guys, my friend's body is amazing. That's awesome.
Nice.
That's awesome. How soon can I go back to work after? Well, depends on the procedure. I would say after a breast procedure, usually it's about a week. After a mommy makeover, about 2 weeks to 3 weeks, depending on the extent of it.
And also what you do.
Yeah, exactly. If
you're an MMA fighter, we'll hold up.
Maybe about a year. That's right. Yeah, but
Yeah.
Most office jobs, I will say 2 to 3 weeks.
Right.
It's reasonable.
Right.
That is great. BBL and tummy tuck. Yeah, 2 to 3 weeks. BBL and tummy tuck, 2 to 3 weeks. Thinking about that to return to an office job. I mean, as soon as 2 weeks, you could be able to drive and do an office job.
Yeah, remember, if you're doing a tummy tuck, usually going to have a drain for at least a week, and sometimes, around 2 weeks, if not more. So you want to ideally have that drain removed before you go back to work. When are we spinning the wheel again?
Yeah.
Everyone wants to know about this wheel.
Why don't we do it next week? We're gonna try to see if we do some, wheel spinning next week. Well, if you guys just join us here in the live and connect, we will feel more encouraged to do the wheel. But we'll do the wheel soon again.
We're coming up with things to add to the wheel, and we're also fine-tuning the wheel, making sure it goes a number of spins.
That's right. Soft spin, hard spin.
Right.
You know,
so we're calibrating
yeah.
it so you don't say, hey, it's always stopping on this, so.
In the empty one.
So we'll bring it back.
Where are you from, doctor? Where are you from?
Where am I from?
Where are you from? You're from
So-
Washington, D.C.
Right. Grew up in right around the Washington, D.C. area, but my background is Persian, so.
Yeah, and I'm from Messi's land, from the Argentina.
Who's now
Who's-
right here,
that's
2
right.
miles away.
That's
we get to
right.
watch
We get to see
the
Messi. Messi
greatest
is our neighbor
of
now.
all time.
We are happy with
One of
that.
the greatest.
So
Yeah.
all of you guys are gonna be soccer fans soon, having Messi in the MLS. That is major. That is awesome. My doctor, you did amazing. Thank you very much. I'm so happy that you guys are so happy.
Yes, you want to answer this one?
Yeah, what is it? I didn't see it. Lista para que me pongas los implantes. Pregunto que por dónde pones los implantes nuevamente. Sería la tercera cicatriz. Normalmente los implantes van por la misma incisión. O sea que no hacemos más cicatrices para poner los implantes. Eso es fácil. Y a veces si la cicatriz está un poquito dañada, podemos revisarla y mejorarla.
Casey asked about drains. Are they easy to remove once you go home? Is the pain tolerable without taking anything? I would say it feels uncomfortable, but it shouldn't be painful. And if you do end up going home with a drain, obviously if you have your primary care physician or somebody a provider that can remove it, amazing. But if not, the post-op team actually does virtual with you. If you can't find anybody to remove it, they will assist you in figuring out the logistics and kind of guiding you on what to do. But it shouldn't be painful. It'll be just more an uncomfortable feeling.
Right. How are out-of-state patients cleared to fly home? So, in our system, we are continue monitoring the patients. We have the premium stay package that usually it requires for you to stay here for about a week, which is great because you're gonna get assistance. Usually after a week, you're able to fly back home. But we see you. We will monitor you and make sure that by the time you are able to go back home, you're ready. So usually about a week is enough, and the reason we will clear you. We will tell you, yes, it's ready. If you want to leave like the next day, you probably won't be ready.
Yeah, remember, this is for your safety as well. And we're monitoring you for X number of days you're here, and we want to just make sure, hey, your everything's okay, your vitals are okay, your labs are okay. We check your hemoglobin, all these things, just to make sure that before leaving, you're in good form. Krista Lee asks, I'm out of town and interested in Lipo360 and BBL. How long?
90% of our patients are from out of the state of Florida. So we are very used to treating patients from out of town.
How long do I have to stick around? If you can stay for, the week with the premium package, that would be ideal. Remember, especially Lipo 360, it does take a toll on your body. Remember, we're poking and prodding you, and there's a lot of fluid shifts, and we're removing fat and fluid. So we want to make sure that you're healing well. So if you can stay for, that number of days that are included in the premium package, that would be ideal, which is right about a week.
Yeah, and it's important, the massages. We offer you the first 3 set of massages, which is super, super important. If you stay in a few more days, you can add more. But yeah, so that is another reason to stay, especially after lipo, in that. Because 916, she's saying that if we put better prices on the wheel next time, and she will come on and show her results. So she's,
I see how it is.
You see, it's negotiation.
Now we're negotiating.
El precio de una operación. Para saber todos los precios, nos tienen que enviar su consulta. So, van ahí abajo del website Top Aesthetics, donde dice Book Now, y luego eligen el Free Consultation. Le hacen clic aquí, luego ponen donde está Get a Free Consultation, llenan este formulario y nosotros les mandamos los precios de lo que necesiten. Okay, eso es lo mejor para los precios. Doctor, after time tag, when I'm going to be ready to sleep on my stomach? I will say usually within a month, maybe about 3 to 4 weeks. Probably you don't want to sleep on your stomach for the first 2 weeks, but usually by a month you should be able to start laying on your tummy comfortably, meaning.
Yeah.
Hello from Greece. It's kind of hard to read, Nico.
Someone is asking if we operate on patients with fibromyalgia.
Yes, we do. We have operated in multiple patients with fibromyalgia.
We do.
Our pre-operative assessment is actually really good. So we've done surgeries on patients on the older side. We've done surgery on patients that have some like medical problems like hypertension, diabetes, things like that. As long as everything's under control and we get the clearance, we can do surgery on patients. But we will let you know. The best first step is to send us a consultation. Send us a consultation. We looked at your case. We create a quote. You know how much it would be. Then we go through the process, and if you're we're gonna make sure that you're a good candidate for surgery.
Someone asked, how many post-op appointments do we have with you after the all week stay?
Yeah,
I guess they're ready.
Yeah, as many as you need to.
Right.
But
we would love to see you every day. That'd be great.
Yeah, we are here at the hotel, so it's easy to coordinate that. But you're gonna be seen so many times by so many people that we usually see you once or twice. But you're gonna have all the post-op team rounding on you pretty much every day. The massage therapy seeing you pretty much every day. The Med Miami team seeing you for the first 2 to 3 days. That you're gonna be here after surgery. So you're gonna get enough of people seeing you and a lot of help. And you're welcome to come and see us to the clinic if you want to. We can always do virtual visits with our team at the in the hotel, and you can talk to us. So our system is really good. That's all I can say, and the patients are very happy.
Absolutely, and if you can't make it in person for whatever reason on that day and you want to come the next day, we send the team to you,
right?
So we could do a virtual or a FaceTime with them checking everything, and we're talking to you, and we show you before, after, side by side. We share our screen, so it's not just a, hey, how's it going? It's a thorough kind of all-included virtual, just to make sure you're okay.
And also, I think, here's one of the questions: how long do you have to wear my compression socks? Very important during the first week when you're not, ambulating too much, or you can do just like me, that wear the compression socks all the time.
And now we get bent.
So compression socks are important so you don't develop varicose veins. You got a good flow. We work standing all the time, so I think it's important.
I should start wearing them.
Yeah, I think it's good to wear the compression socks as much as you can.
Once you're ambulating regularly and you get the blood pumping and going, you can stop if you want. Some patients, I say, if you can wear it, why not? Even better. But that's usually after a couple of weeks when you're ambulating. Someone asks, is a hotel stay and massage included in the packages? Yes,
Yeah.
they are
Yeah,
included.
we had the packages, and a lot of times when we launch the promotions, they're usually included. It's in our mutual best interest to do this because it's the best care possible that you can get. And we had put all the, we had a few patients recently that had prior experiences in plastic surgery, and they are really, really happy with everything that they've been through, having had prior experiences. Because when you come here for the first time, you think everything's like that, and usually it's absolutely not like that. So we had thought about everything, and you're gonna have a very, very safe environment with everything figured out for you, and that is like, I don't know, you can put a price tag to that.
Yeah, absolutely.
Had my surgery with Dr. Palladino in February of this year, and I love my results. That is amazing.
Awesome.
That'll be good if you guys come and talk to us, and show us your results. Well, we'll believe you, but it's nice for the other people to see it. There's more questions here. The States, we answered that one. What's your experience with tubular breast? Can they be corrected? Yeah, I think usually you might be referring to what we call tuberose breast, and yes, absolutely, it's usually treated best with a periareolar breast lift / augmentation. If you put an implant, it's better, and yes, it can definitely be addressed, and it's a well-known condition. Tuberous breast is those breasts that get a constriction ring around your areolar complex, and then a lot of the tissue herniates, so they come out like a little tube, I guess, through that nipple areolar complex constriction. So you have to release all that. If you put an implant, it gives you better expansion, and you can fix it. Okay, so Tisha says, just uploaded a picture for my consultation. That's awesome. Thank you so much. Like, if you guys are interested, it's super easy. Click the link in our bio or go to topaesthetics.com. Just book now. Send a quick. I will be interested to know. She just did it, so I don't know how long it took you. Probably like 5 minutes. So it's really, really simple, and we will get back to you with an answer, and so yeah, absolutely.
Yeah, and as soon as you book, we get a notification, and the coordinator speak to us and make sure the right surgery was coordinated with everybody. So it's a 360 process with everybody next door and you.
All right, so here is be booked for January 2024. Super excited. That's awesome. Thank you so much. We are so too. So looking forward to seeing you in January. After the BBL, can I sit on my butt after 6 weeks? Of course, you can sit in your butt immediately using the BBL pillow for the first 3 weeks, and then after that you can sit however you want.
Yeah.
I think the critical periods are actually 2 weeks. We just go 3 weeks just to make it the safer side, but yeah, and we'll provide you also with all the accessories. That we didn't mention that, but you're gonna get a goodie bag with a lot of the accessories, and it's actually really, really nice. It has like a good $400 or $500 of accessories, including your fajas, your foams, your boards, your BBL pillow, your
creams,
arnica, all the creams, scar gels. It's actually really nice.
And a very nice tote bag as well that you could take to the beach and just
That's right.
fill it with your favorite snacks.
No snacks.
I don't know what he's filling it with, but anyway, that's a different topic.
Like our bottled water. That's why you can fill it up with Top Aesthetics bottled water that you can get in our amazing store.
Yeah.
As well as your hats for the sun.
Exactly. But there's actually a YouTube video if you go on the YouTube site that explains exactly what's in the bag, and so check it out.
Hey, I don't want to forget also to tell you about that you're going to be doing your pre-op at the Med Spa. So there's a lot of services available at the Med Spa. Okay, the Med Spa is a beautiful place, a nice environment. You're going to be super relaxed. You're going to be interacting there with, Leandra. The girls at the Med Spa are amazing. you can also have like a hydrofacial, IV infusions before surgery, after surgery. You can have, maybe some Botox, maybe, just some pampering. While you're here, since you're gonna recover anyway for about a week or so, you might also just kind of refresh your face, and there's a lot of treatments that we can provide at the Med Spa. So if you haven't yet, you should look into that. Again, go back here in our Top Aesthetics website. You're gonna get to here. It says plastic surgery, and here it says Med Spa. So if you click on the Med Spa section, you're gonna see everything that that you can get, and you're gonna get to see, meet the people. This is Dr. Faith Finoli. She's gonna be there. She can do your Botox, your fillers. This is Leandra. She can take care of your skin. She's gonna do your photos. Amanda is there too. So it's going to be a really, really good experience. So, look into that, and I don't want to forget that there's a lot of Med Spa services available for you guys as well.
Yeah, and it's also right on one of the best streets in Fort Lauderdale. So before your surgery, usually the next day, that'll be the kind of last meal you could eat, good meals. So lots of options, right there on that street to have a good meal and a protein-rich meal in anticipation of your surgery the
and
next
this
day.
is really walking distance from the hotel. It's probably about 10 blocks from the hotel. This street is called Las Olas. And there's a lot of touristy stuff that you can do there. So while you're here, you can also, do some tourism, if you're not from Florida. But if you're from here, it's also a beautiful place to hang out. Let's see.
Okay.
Oof, more. It's already 6:10 or so, 6:08. All right.
These questions.
Do you guys check the pictures in the DMs? Yes, we do. We do take the pictures in the DMs, but the DMs are not the best way to submit a consultation because we cannot give you a full answer, including the quote and all that. So the best way to do, although we can send you also, look at the pictures, we can send you the link, you can fill out the consultation, upload those same pictures, and we'll go from there. The best thing to do is
send it. I mean, there's so many stuff that comes through the DMs that sometimes things get lost, and I'm guilty for not going through all of them. So, but if you can send them through the website, that for sure we will see, and so that would be the better option if you're going to send photos.
Okay, his screen says I didn't get your virtual post-op when I was there. What is the schedule? I haven't heard from the past. For Topos team. Okay, yeah. So reach out. You can text the post-op team. They should tell you, but 2 weeks, 6 weeks, 3 months, 6 months, and a year, they're gonna be automatic reminders for those. So you're gonna get them. Okay, if we have your phone number and your email, then which we did just because that's how we communicated with you throughout the process, and you're gonna get a reminder for those appointments. So those are the virtual appointments. So if not, you can always reach out. The post-op team, just text them right now, and they should be able to give you the link again. And so you can submit your info, and then we can do the.
I remember at your 2 weeks mark, your 2 week virtual is when you send in your pictures as well. That's when the post-op team can actually do side by sides of your pre-surgery and your now pictures that you can actually see. Whoa! Look where I was. Look where I'm at now. So if you do take your pictures, that's another benefit for you, just so you can see your progress.
Yeah, and I think part of what he's mentioning in sending pictures are crucial. Before surgery, we can actually, if you send us good pictures, we do create the simulations that allow you to see how you are going to look after surgery, or at least the closest that we believe you're going to look. And this is great for managing expectations. You can kind of tell what we can do and we cannot do. So, so that is important. On the other hand, after surgery, we always put together before and afters with your last set of records. So I think that's very, very important and something that is very uncommon, and we do that. So if you are consistent with your follow-ups, you're gonna have a really, really good progress, and then we can address any issues that happen during the post-op at the right time. You can't come back after a year. You never contacted us back and said, "Okay, I have this so and so." Why didn't you send us stuff before?
Right.
All right, finishing up. Let's few more questions. Are there non-credit payment plans available? Non-credit payment.
No credit
I
card
mean,
payment.
we do payment plans, but you have to talk to the coordinator to see how we coordinate, how we do that. Okay, so there is a structure for payment plans. Then usually the surgery has to be paid in full before the procedure happens. So
Yeah, and some of the options are right there on the website if you want it.
yeah, if you go to financing in the website, it will tell you. A lot of times you can even check with like Care Credit or Alphaeon for the rates and things like that. It's like a soft pull of your credit, and then they will give you an answer immediately on how much you want to finance and how much the payments are. And there are payments that are interest free, so
Someone says, not sure if anyone has watched your live from a plane, but I am right now.
that's amazing.
There you go. Nice.
That is nice. Well, we are on the
That's
air,
awesome.
on the literally on the air. That's amazing. Yeah, I guess they say you can have a phone conversation, but we can definitely watch
Yeah.
live. That's amazing. I submitted and Jennifer responded immediately. She is outstanding. Thank you so much.
That's
yes,
awesome. Jennifer is one of our
coordinators.
along with Melissa and
Lindsay, yeah.
and,
These guys are
Times
amazing.
Annabella, so they're amazing.
Thank you. You guys do an amazing job. Thank you so much. Thank you guys. Thank you for tuning in today. We want to just answer as many questions as possible.
Yeah, and we will try to get the wheel going next week.
That's right.
We'll try, but if not next week, definitely within the next couple weeks, for sure. We know there's been a bunch of people requesting, and we'll let you know maybe this time ahead of time, not the same day, maybe a few days before, and go from there.
Which surgery path you guys chose after graduation? All right. That's a little bit of, like history lesson. So, usually after graduation from college, I would imagine you do pre-med, and then, you get into medical school, and that's 4 years usually. And once you're done with medical school, then you have to do residency, which is the training for whatever specialty you're gonna do that. So today in the United States, you can go into an integrated plastic surgery program, which is about 6 years. So it's 4 years plus 6 years. 4 years of medical school, 6 years of residency for plastic surgery. I did it back in the day a little bit different. So we used to do general surgery first and then plastic surgery later. So I did like 8 years. You went a similar route, doing general, yes, and then the cosmetic surgery after that. So there are different ways of doing that. But all in all, with college included, is probably about 14 years. So it's a long career, but it's very rewarding. So pre-med, medical school, residency. Now there are residencies. All surgical residencies are going to be about 4 to 6, 8 years, depending if you do research or not. So it's going to be the longer path if you do any surgical subspecialty.
Yeah, there's different ways into either going straight into a plastics integrated or a surgery, surgical residency first, then into it, or a surgical residency and then a cosmetic surgery fellowship. So there's a few, but unfortunately they're all very lengthy after graduate, regardless of what surgical specialty you go into, whether it's plastics or other, or go into plastics and aesthetics, or certain surgical specialty and then cosmetic. Usually a lot of these require the usual regimen and maybe some research, so they're long, but
very good. Krista says, I had surgery at the end of June and I got a seroma. I had it drained and recurred. So is this common? I'm getting repeat ultrasound. Unfortunately, seromas are the most common complication, if you want to call it a complication. It's almost so common that it's not even a complication, I would say. It's a fluid accumulation. This is the reason why we leave drains. But even with even the drains, sometimes seromas happen. It's a very simple thing to deal with. It's just some have to drain it. And yes, it's very common, so it's worse if you had prior surgeries as well, because your lymphatics are already a little bit damaged. But yeah, in general, that can happen, but it's easy to care for and take care of that. Especially if you're around and you come here, we will drain it for you, or we will send you an ultrasound.
Yeah, very common. It's nice if you're here with us and you get those massages, so we get all that fluid out. And if you do have a seroma before you leave, we can address it right here in the office. So.
Para hacer ejercicios, doctor, ¿qué tiempo debo esperar si me operé en junio? Para empezar a hacer ejercicios debes esperar por lo menos 6 a 8 semanas, 2 meses, julio, agosto. Podrías empezar en septiembre, digamos. All right. Melissa is a good coordinator. She's amazing. They are all of them. Jennifer, Melissa.
They are. Our
Lindsay,
coordinators are, and they are very knowledgeable in all the procedures as well. They really, know the ins and out of every procedure and what may be best for you as well, even though they always confirm with us and go over it. But I would say, 95% or maybe even 99% of the time, what they suggest is usually what we end up approving as well. So they're all fantastic.
Yeah, we do that also as a training exercise, because we want them to make sure that they are understanding the whole concept behind it. So it's a really good way, and they've been with us for years. So it's just once you do this so many times, you get actually pretty good at that. And now there are always more advanced cases, massive weight loss patients.
Someone was asking, do we do awake?
We don't.
Guessing liposuction. Do you guys put people to sleep, or can they stay awake?
We do it the most comfortable way.
Right.
Yeah, you don't want to be awake for any of this. Believe me. Maybe you want to be awake for like having,
I mean, we had a patient actually today that I, operated on. I mean, it's just also the extent to which you can do a certain procedure.
Yeah.
Some of these procedures, if you really want to get as aggressive, you might not be able to. Not that you can't. You can absolutely do awake procedures, and we're not dissuading, or saying anything negative. But sometimes it can be tough. For example, muscle repair would be something that's usually not done, in awake. Correcting the diastasis.
There are certain small procedures you can do awake, but believe me, liposuction, tummy tucks, those are, in my opinion, are not really good procedures to be done awake. And also know that when you say awake, you're not really awake. Usually they put you to give you a level of sedation that sometimes, if the practitioner is not very, very well seasoned, like an anesthesia provider, or they know, it's kind of hard to have that little thin line between being too asleep or not asleep enough that is uncomfortable, and if you're two-way asleep, you don't breathe, and then that could be a problem. So in my opinion, it's much safer to do it the way we do it. You had to have really a very, very good and knowledgeable anesthesia provider to give you a very good kind of sedation, but you can't do a really good lipo job if you're completely awake. We see patients all the time that had awake procedures, and they're very dissatisfied with their outcome. So
right, they want to do additional procedures. So
What
usually we put patients to sleep.
What is the cost for a tummy tuck? Consultation right there, free consultation. Fill out the form. We'll get you back the cost.
If you do schedule in that time frame where there are a couple openings, you may be eligible for
one of the
specials.
Yeah.
If it's during this whatever days are available. During that special
range 5,000 to 12,000. There you go.
Right.
So, but I don't know. If you lay on the lower end or the higher end, we have to see your case. Do you ever use a Dermascan type product on incisions?
I'm assuming maybe Dermabond is sort of procedure maybe you're referring to, like the glues maybe.
Maybe.
or there's also these closure devices. I don't know. Either way, usually no. We take the time to suture the incisions.
Yeah, we don't
Um,
we don't use any glue usually, or any. I don't know what that's. Yeah, that's probably what she was referring. By the way, all our suturing is absorbable, so we don't have to really remove any sutures. The only suture that we might have to remove is the drain suture, but that's about it.
Yeah, I do know there are some closure devices that can be used on the skin, and we just personally don't use them here. We use the sutures, so
That's
whether
right.
they're good or bad.
All right, it is 6:22 now, so we already give you an extra 10 minutes on our usual live, but we appreciate.
It's a Christmas gift to myself.
That's
Just
right.
sent my consultation. There you go.
Good, that is excellent. You think it's to yourself, but like I was talking today to this beautiful couple that that's gonna have surgery very soon, and the ladies do this for them seriously, because we love our ladies, the way they are, obviously. But believe me, like in my opinion, this improves your self-esteem and your relationship and the other person's your significant other. So it's actually improves the whole situation.
And us too. We get super happy when
Yeah,
we see your results.
course.
Yeah, it's a gift to
We're
us
happy
too.
seeing so many patients here that they're
Yeah.
happy with the results and the experience.
I mean, when you send your photos and follow-ups, and you're super happy and excited, really, everybody gets happy and loves to hear about it, and so.
This is why it was worth to go through so many years of training and misery and doing this, but it's, in general, it's actually a really, really good specialty, really good. You feel doing a lot of good things.
Brazil
for
in the
people.
house. All right, represent.
That's right.
All right.
All right, guys.
Well,
We will see you back next week. We may bring back the Wheel of Fortune. Stay tuned. As
with
per your request.
some different options as well this time around. So,
Yeah. So
although next week is also ZozoFit.
yeah, we'll bring this also fit people as well.
Oh,
So
Wow,
so
okay.
you can learn more about this body scaling procedure, like suit that allows you to see how much your body has transformed. We have some patients to show, and I try to reach the 2 or 3 patients that have done it already, see if we can get good pictures and see if we can track their progress with this also feed. And maybe we can have one of them join us and see, show us their experience. So,
and remember,
okay.
a part of that is if you do your ZozoFit and follow up for the year duration,
yeah, we'll give you the money back.
you'll actually get the ZozoFit fully refunded. I mean,
Yeah.
so why, it's just send in a couple measurements throughout the year. So.
Yeah. We'll give you more next week. All right, everyone.